Thanks for choosing us. Remember, we are your home of independent, fearless, and credible journalism. Well, this afternoon, government officials are defending their decision not to interdict the Amansie Central DCE yet, despite JoyNews' expose, attacks for Galamsey, and a petition that government agreed would trigger both investigations and his suspension. Days later, that interdiction has not happened. The Ashanti Regional Minister says suspension is not automatic without first establishing the facts, but CSOs have rejected that explanation. There's more in the following report.
A tax for Galamsey. JoyNews' explosive documentary in the Amansie Central District uncovered an alleged system where illegal miners were taxed under the watch of the District Assembly and a task force operating within the DCE's authority. Government says investigations have commenced, but the District Chief Executive, Emmanuel Obin Ajiman, remains at post despite earlier indications he would be interdicted. Some government officials, including Ashanti Regional Minister Frank Amakohene and Deputy CEO of the Forestry Commission, Elikem Kotoko, insist interdiction is not automatic.
Clearly, if the laws of the natural justice are applied in this sense, the mere fact that allegations are levied against you does not mean that you should start through or you should interdict you. Definitely, there should be evidence and a case made against you.
You raise a concern also about the interdictions, etc. It is not also an established must that at all costs there should be an interdiction. One would, however, adduce that that could be seen as an appropriate step or the right thing to do, especially if it is suspected that maybe the persons involved may in one way or the other interfere in the process.
They spoke on JoyNews' latest national dialogue on illegal mining, but civil society groups strongly disagree. For them, interdiction should have been the first decisive step.
But I humbly disagree with my brother, the minister. I think that the government should be more decisive and prompt in terms of their action than they taking all this time that they want before they really act.
So if that is what will help the process achieve what we all want, well then let that be.
Even the president of NALAG, Alfred Ajayi, says if there is prima facie evidence, suspension must follow.
If the DC is also aware of this, then it is also wrong. So let's establish that clearly.
And so you agree with us that they must be interdicted?
Yeah, that's what I say, on condition that the prima facie has been established.
And Amansie Central may not be alone. Kenneth Ashigbe of the Ghana Coalition Against Illegal Mining says there are similar practices in other districts.
I have given the example of the Tana North, with and Erastus was the one who shared this, the Tana North one. I've given the example of the Dunkwal, the MC in Dunkwal. They also give it. Let's go and find out that all the stickers that they have given, they should have records of it. Are all those people responsible miners?
Deputy Ranking Member on Parliament's Local Government Committee, Alexander Akwa, says there's even more.
In my assembly, you didn't have to go with a hidden camera. My MCE has receipts that with the inscription, fine for illegal mining, and he justifies it.
He claims some assemblies even account for fines from illegal mining in reports to Parliament.
And we were going through their audit reports. And so we're checking how much monies have come and how they have expended those monies. I was surprised that some will come and will want to come and give account on how much taxes they have collected on illegal mining.
Meanwhile, the environmental toll continues to mount.
We've done research, we did some research in December and November. The level of turbidity in some of the waters, and not only turbidity, but also the level of heavy metals in some of these water bodies, and the damage that is causing to all of us as a people. We should be attacking these things with a lot more, urgency than we are doing.
Actually, we have more than, I think, close to 50 forest reserves that are now affected by Galamsey and no longer 44 or 45, as has been said.
As investigations continue, the Ashanti Regional Minister has called for a review of all bylaws, with problematic ones to be repealed.
Indeed, NIMOS is doing what it can and has even improved. In this year alone, I mean, from January to now, there's been numerous arrests. The next step of engaging the Attorney General that let's now begin to look at effective prosecution.
But critics say promises are no longer enough. They are demanding enforcement, accountability, and measurable action.
Stiffen the punishment. So let's make sure that for all of these people, we give them the punishment of both the fine and the custodial sentences so that we can start using the Minister for Lands and Natural Resources does not even have a budget for reclamation of land. So we can then give them money. So those money should be dedicated for the reclamation. We need money for NIMAS to be stationed permanently. We make sure that the fines and things that we'll get from these people, we give it to NIMAS to be able to be stationed permanently, so that on a monthly basis, any MCE, any EPA official, any MENCOM official, any policeman that has Galamsey happening and we've not seen any report from you saying that we want to deal with it, you should be held responsible.
I think we need to start sacking people, getting people interdicted, and until that happens, we will not really make any progress with this fight.
The Catholic Bishops' Conference says it will continue to mount pressure until prosecutions follow.
We want those who are found culpable to be arrested, prosecuted, and jailed. So we want that to be done. We also want that every system, every levy, or any informal, tax regime associated with illegal mining, we want it dismantled now. Because if it is not done, we will do our checks, we'll do our investigations, and we shall expose them. So that should be clear in the public domain already.
Illegal mining remains a national test of leadership and accountability. Whether this moment leads to real reforms or fades like many before it, now rests with government. For JoyNews, Maxwell Akroboto's report, read to you.
Well, away from that, President John Dramani Mahama says he's confident Ghana will soon have its first female president. The president, who was speaking at a high-level dialogue on gender at the margins of the AU summit in Ethiopia, explains that women empowerment is at the core of his social-economic policies, which will deliver true development for the people. Ghana having made history with the election of its first female vice president, Professor Nana Jane Opoku-Agyeman. The president is confident that Ghana will soon have its first female president.
Policy. Ghana has achieved historic milestones, including, as our foreign minister said, the election for the first time of our first female vice president, Nana Opoku-Agyeman. An unprecedented representation of women across government, the judiciary, and other national institutions. I'm confident that sooner rather than later, a woman will occupy the highest office of president in Ghana.
Meanwhile, Vice President Professor Jane Nana Opoku-Agyeman has announced that government will soon begin the implementation of the Women's Development Bank initiative to support women-owned businesses. She says though there have been claims that the bank's rollout has been delayed, government does not intend to rush the process and will instead ensure a progressive implementation of the process. The following report has more.
The Women's Development Bank is expected to be a game changer for many women, strengthening their businesses and easing access to loans. Amid concerns about delays in its rollout, Vice President Professor Jane Nana Opoku-Agyeman says the process is far advanced and the bank will soon become operational. She gave the assurance at the 65th end-of-year gathering and General Assembly of the Greater Accra Markets Association.
Some people have questioned the delay in rolling out the bank. I would have been happier if it had come earlier, but you need to take your time when doing anything properly. I can assure you that steps are far advanced to start the bank.
President of the Greater Accra Markets Association, Mercy Afrowa-Nijan, expressed gratitude to the Vice President for the initiative. However, she raised concerns that the refusal of some importers to reduce prices is negatively affecting market women.
We have seen the reduction in fuel prices and the improvement in the value of the cedi against the dollar. However, we are very worried that importers have refused to reduce prices of goods in the markets. And this is affecting our members and consumers.
Greater Accra Regional Minister Linda Okulu assured the traders that government will look into the matter and engage the relevant stakeholders.
Going back to the table to see how best they will resolve that issues. And like she said, some people, that is what they told us, that they have previous goods that they've not sold yet. But the fact that you've not sold goods here doesn't mean that you cannot reduce the prices.
Accra Metropolitan Chief Executive Michael Alote also pledged to work relentlessly to ensure the city is decongested and made more business friendly.
I'm a young man. Your Excellency Dramani Mahama knows there's a time for a young man to shake Accra. So I'm here to make sure that shake will work. And you can see, since assuming office, I have never sat down. I'm not an office person. I'm always out there. So I'm training very well. I'm training very hard to make sure Accra will be fixed.
The engagement forms part of government's broader efforts to deepen collaboration with market leaders and ensure that policies aimed at empowering women and strengthening local businesses deliver real impact. For JoyNews, Fatao Bayaga, Accra.
Away from that, the John Kojo Japong Regional Minister for Oti Region has raised concerns over the growing number of police personnel seeking transfer out of the region. He warns that the sharp decline in officer numbers has reached alarming levels, posing a serious threat to security. The minister made the remarks at the Made in West African Security Social Activities gathering in Dambai. Peter Seno has more in this report.
The Oti Regional Police Command has organized its maiden West African Security Social Activities meeting at the regional capital, Dambai. The essence of the meeting is to unwind from the previous year's schedules and re-strategize for the new policing year. DCOP Alex Aqua is the Oti Regional Police Commander. He lauded his men for working hard despite the numerous challenges faced by the police service in the region.
This occasion affords us the opportunity to pause and reflect on the quiet yet impactful work that sustains peace, security, and public confidence in our region. In spite of the numerous challenges confronting us, most notably the limitation in our numerical strength, our security personnel have continued to distinguish themselves through unwavering commitment, resilience, and professionalism. With resources stretched and manpower constrained, you have remained vigilant, responsive, and steadfast in the discharge of your duties. It is therefore noteworthy that, despite these constraints, the Oti region has recorded minimal crime occurrences.
COP Dr. Saibu Pabi Garba is the Director General, National Protection Department, who graced the occasion with his team. He lauded the Regional Police Command for containing conflict hotspots in the region.
The past years have not been without challenges. The Oti region, with its unique geography and diversity, has presented demanding security responsibilities. Notably among these were the intense clash between the Adele, the Achode, and the Chalas communities in Nkwanta South Municipality, as well as the protracted conflict between the Nkunya and the Alabanyo Township. Notwithstanding these difficulties, the Regional Police Command, OT, through professionalism and dedication, has recorded significant successes, including improved visibility, swift response to distress calls, reduction in violent crime, and stronger collaboration with the communities.
The Regional Minister, John Kojo Japong, has lamented police attrition rate in the region. The demand by police officers to leave the region, he says, has reached an alarming rate.
I wish to seize this opportunity to emphasize the decreasing numbers of our police personnel in the region. The numbers are declining at such an alarming level that has not been experienced before in the short history of the region. And I find it very worrying. It is my firm belief that the commanders, luckily my brothers from Accra, will convey this message to the Inspector General of Police and treat the Director General of Human Resources is present with us, and I wish to make a direct appeal to him about this appointment.
Other senior officers who were present have called on the feuding factions in Nkwanta South conflict to embrace peace for development. Peter Senu for JoyNews.
Well, let's explore this further. Join me now is security analyst Professor Kwesi Enin. We appreciate your time here on The Pulse. I was just hearing troubling revelation from the OT Regional Minister that some of their officials are seeking transfers because of the protracted clashes in some of the areas in the OT region. Your thoughts on that?
Well, I think this is a problem that is much wider than the OT region. I mean, it's a structural problem in which officers and men don't want to be to particular region, or when they are posted, they use every trap in the book to get transferred, sometimes even on the blind side of their commander. So this is a much bigger problem than the OT region that needs to be looked at by the police management.
But the police, they are trained for combat, so why run away from it? The question on our minds.
Well, the real question then becomes, yes, they are trained for combat, but issues around logistics, loyalty, willingness to put oneself at risk, for the country and for the institute. Look, I've just traveled around this country doing an arborist inspection. And the sentiment being expressed by the regional minister, who I salute for being honest about this, cuts across almost all the security agents, and their heads make similar complaints about staff unwilling to serve for a long time and then using their network to get them, transferred. This has an implication on the way that we assess our risk and the way that we then deploy the manpower with the appropriate logistics. But as you correctly said, if people who have sworn to protect us themselves are not willing to serve in a particular environment, then I think we need new tools of assessment when we do the recruitment, training, and the posting. And then to ensure that people cannot be moved prior to the end of their talk. But what the minister is talking about is a very widespread problem across all the security, possibly with the exception of the Ghana Force.
And how do we address it moving forward? Because usually we would hear of the need to resource the police, but now even the willingness to be active in service is a problem.
Well, I mean, it's a leadership issue, and it's a disciplinary issue. If you ordered serve at a particular point in a particular place, time, it is not your right to go there and say, I'm not willing to serve you. Because when you signed on to the service, you knew and you accepted that you could be posted anywhere and everywhere at any time. But for I think, as I'm arguing, this is a bigger problem of loyalty to the state and our conception and understanding of why we stand and what we are willing and prepared to do. And were we to do the responsibility or perform our duty and to pay the ultimate price. Will the state take cognizance of that? So, and history to them. So, I think what the regional minister has said, it's good. But I think he has just scratched on the surface of something that we need to have a much bigger conversation.
And would you propose that we at least champion an awareness campaign? You see how people are quite afraid of the military service. It doesn't appear same when it comes to the police. The reason why some of them feel that they're easy victims.
I don't think people see the police as easy victims. Look, when the police want to work, when they decide that this is a case of interest to act, and therefore we want to act, they are as effective as any other police anywhere in this world. The lacuna here is to ginger them up, to give them fair access to training, to promotions, and I think there's a lot of promotions recently.
Okay.
But to ensure that they deliver to what they are signed up.
Okay.
I don't think this is rocket science. Okay. But the meddling in the system. This chance for asking for favors for our friends, our family members, our party members, and can't you do this little favor for me? That is what has created this culture of I don't want to serve in this struggle. But it can be dealt.
Okay. Unfortunately, we seem to have lost Professor Kwesieni. He's a security consultant, but point well noted. Away from that, the Food and Drugs Authority has clamped down on unlabeled, unregistered diaper products in the whole market of the Volta region. The exercise was aimed at cleaning the market of these counterfeit products that pose health threats to consumers who are basically children. The following report has more.
The Volta Regional FDA Director, Gordon Akurugu, led a team of officials from his outfit and the Ghana Police Service to undertake the exercise. With a strategic plan and concerted efforts, the team raided several shops, resulting in the identification and seizure of several suspected counterfeit diaper products. Brands confiscated include Santi, Amanda, Sayil, Forever Cotton, Maya, Smart, Jasper New, among others, which were found on the shelves in the market. Gordon Akurugu set the roadmap for identifying the direct source of the products.
The people we have picked the product from in whole market will be given to police for further interrogation for us to know where the products are coming from. It is important for us to establish where the products are coming from. They are just market women who probably have also gone somewhere and bought it. So we want to know where it is coming. You also bear with me, Volta region in particular is closer to the neighboring countries. So it is also possible that they're smuggling these things into the region, which we want to ascertain the source. And this is not just one day exercise, it's an exercise that has to continue. We've been doing it, but we just want to probably put emphasis on it that this is an important thing that will save life, because children are our future leaders and we think that they should not.
He also cautioned mothers to be vigilant when shopping for products for their children.
We control the import to ensure that the product coming in is safe, is efficacious and wholesome for use. And therefore, if it comes into the country and FDA is not aware, and we can't therefore guarantee the safety and quality. And the law is very clear on that. So if we see a product that is not registered in the market, it is against the law, and then you face the full records of the law. He is questioning everybody, a parent, a mother, to buy registered diapers. They are there, you can see registered diapers. Most of them are in without label, but the registered one, you see label and see FDA number. And that is what we want every parent to do. Life of a child is important to Ghana and FDA.
Fred Kwame Asari, JoyNews.
Away from that, government has set a target of producing over 7 million chicks under the Nkukong Kitin project as it scales up the nationwide rollout of the initiative. National Coordinator for the Feed Ghana program says the rollout of the Greater Accra chapter of the initiative forms part of efforts to boost local poultry production and reduce dependence on imported chicken while creating jobs across the value chain. Greater Accra Regional Minister Linda Oklu has been speaking at the authorization and distribution of a day-old chicks and some other materials for the project.
From the Ministry of Agri to every beneficiary who is interested. So they bought the forms. We've inspected. There has even been a training for all the beneficiaries how to keep the birds, and they have technical support for every beneficiary within the district. And so we are going to ensure that first, the distribution is fair. We want to make sure that one person wouldn't take ownership of the and distribute to his or her family. No, we make sure that those that have registered, because it was everywhere, widely open, the forms were everywhere and every interested person bought it. And so we ensure that everybody who bought or filled the form, is benefited.
Any more questions?
Oh yes, they have task force aside the technical support who also be going around, to give them their support. In terms of how to take care of the birds, some of the things they have to use to ensure that the birds that are given to them live. Because if you send it to and the bird dies, what's the essence? And so we make sure that sustainability is key. And so we make sure that we monitor closely. And at the end of the day, media, you're everywhere. You can even visit any of the districts or any of the beneficiaries to see how the birds are faring. So thank you.
Well, my colleague Stephen Mensah is on the ground and he's been interacting with the minister. Join us on Zoom this afternoon is President of the Ghana National Association of Poultry Farmers, Mr. George Dansa. We appreciate your time here on the Pulse. We've just been hearing from government they are scaling up the rollout of the Nkukong Kitin initiative. You must be pleased.
Hello?
Hello, Mr. George. Can you hear me?
Yes, I can hear you now.
Great. We're just hearing from government that they are scaling up the rolling out of the Nkukong Kitin initiative. As farmers, you must be pleased, poultry farmers.
Yes, good afternoon to you and all the listeners. In fact, this Nkukong Kitin policy, I've said it on several platforms, that it is a very good policy, very, very good. However, the way it is being implemented is our worry. And from the word go, we decided to see if we could get audience a minute so that we can get to understand the concept. So we can also explain to our members without any ambiguity. But as we speak, I have not had the opportunity to speak with the minister. So all we hear, or all we can know about it is what we hear from the media. So as we speak, sometimes our people, most often will even say that we should have a conference to talk about it, let the Ghanaians know that the whole policy is being rolled out without actually some kind of engagement with us. But we at the leadership level, we hesitate to do that now. But as we speak, whatever is happening, the engagement is not there. We only see on TV and hear from radio what the government is doing. But I said the policy is a very good one that has the potential for changing transforming the poultry sector in the country. But, always these policies that are always fantastic, that are always good, they are many times politically motivated. And so when they are rolling it out, it is shrouded in politics. And as a result, sometimes if care is not taken in the end, the main objective, we are not able to get it. So if you ask me, we are happy that the government have a policy like this, but implementation is what we are concerned about as we speak.
So, Mr. George, are you saying that as an association, your members have not been consulted in any way or form?
Yeah, as an association, if we are to be consulted, I being the national president, I should be in the picture. We wrote letters to the minister, example. We wrote letters. There is a fourth letter that's yet to get to the minister. We just wanted audience. We sit down, we tell the history. This is how, you know, we are the ground. We are the ones that end poultry pen very clean, but we come out very. We know the secret how these things can be done for a successful end. But I am telling you, authority, we have had that opportunity. I am the national president. I have not had that opportunity to meet with the minister. And it is something that is worrying.
And you mean the Agric minister has not even responded to your letter?
No. The last letter, I followed up with my executive secretary. That was before the Farmers' Day celebration. I went to the office, met the personal assistant, who told us that after the Farmers' Day celebration, they will get to us. As we speak, no. So we've written another letter that will soon be, but I'm yet to send it to the minister.
And what recommendations would you have for government, especially now that they're doing a nationwide scale-up of the initiative?
Yes, what we will recommend is, you know, people that are always being, the beneficiaries of this policy, government should make sure that at least they have some basic knowledge of poultry rearing. They have that basic knowledge so that whatever resources or inputs are given to them by way of the chicks and then maybe feed, they'll be able to utilize it well so that in the end, these birds that are being given them will grow well. If that happens, the whole nation will benefit. After all, the main objective is to try to reduce the importation of chicken. So if these chicks that are being given to the beneficiaries, they grow well, at the end of the day, it's going to be there is going to be a lot of chicken in the system. So we are saying that all people that are beneficiaries should at least be given some kind of training so that in the end we'll not be talking about causing financial loss to the state. That is why we are also thinking that for this agricultural policy to succeed, the government should also be thinking about giving local production a kind of quota. Now, if we have a quota, say 20% for the local production, which will be scaling it up as time goes on, so that those who import the chicken will be importing 80%. So gradually, we'll be scaling it up. By a situation where nothing is being done in that area, the people that import chicken, they are still importing whatever, numbers they are importing, they are 100%. What we are producing in country, what we are doing locally, the question is who consumes them? Because when you look at it critically, what we produce in the country, because of cost of production, our price is a little bit higher than what is being imported. And any rational human being will want to go in for the cheaper ones because of their pockets. But we think that government should deliberately do something about the importation, which we are not seeing anything being done. So we are thinking that if we are giving that audience to meet with him, we'll put some of these things across so that moving forward, while we are producing locally, anytime we produce, it will be consumed. We also want to thank the president first and foremost, there was a pronouncement that schools will be buying the chicken, the local produced chicken. And subsequently, when they were reading the budget, it was mentioned by the Minister for Finance. In fact, as we speak, we met with the Minister for Education on 2 occasions where Charles was involved. We were able to have a committee to come up with the modalities. We are thinking that apart from the schools, there are other institutions that the government also feeds, like hospitals and prisons. And sometimes when our military people are on peacekeeping, the government feeds them. So all these people, there should be a directive that they patronize the local produced chicken. That way, whatever we are producing will be consumed, and it will help to scale up production. And these are some of the recommendations we think that if government should do, will help the industry to be transformed.
And then finally, do you have the capacity to meet the demand, really? Should government do all these recommendations that you're proposing?
My sister, if it is because currently some poultry farmers think that we don't have the guarantee that when we produce, it will be off-taking. We have a lot of structures that are empty. That if government should come out with a policy that they are giving local production a quota, I can assure you that we will be able to scale up, produce, and as we go on, as we continue to scale up the local production, if the government should be increasing the quota for local production, we'll be able to meet it. We have a lot of farmers, a lot of structures that are empty that we can produce. We only want the government to try us and see what we can do.
Thank you so much, Mr. George, for your time here on the Pulse. Away from that, ahead of Valentine's Day tomorrow, a bread-making company, A1 Bread, fed and treated staff of the Multimedia Group Limited with a sumptuous breakfast. The meal included delicious bread filled with fried eggs and a mixture of vegetables, complemented by a cocoa drink as a thoughtful gift to the company. Sales manager at A1 Bread, Isaac Datsy, talks about the love accompanying their gesture.
Month of love, so what we are doing this month is that we are showing love, and so we are providing breakfast, our signature chibum, which is made with love and then accompanied by the nature chocolate drink. So today we came over the years, all the work that you've been doing, we said we should come and then show you love. So as we know, February is month of love for sharing. So I encourage whoever has to give anybody who may not have.
Well, still on Valentine, it's just 24 hours to Valentine's Day, and the conversation around love taking center stage across the world. But in Kumasi, sale of paraphernalia has dwindled as many vendors anticipate last-minute trading.
Area was the ama for pressure and for person may packages more for
people are making packages for their loved ones, so I'm pressured to produce more. The sales from last year was better.
And compared to last year and this year, I think say last year no nanko for approaching tema better tournament 10, but I think say we no more change Caribbean last week on Babeto. See, I think say last year no okay than this year.
The market trend changes every year. We normally bring varieties of items during Valentine's Day. The teddy bear is usually bought at all times, but during such times, we normally add chocolates, other gift accessories.
Last Vows Day was better because I think this year bakers are also so business compared to last year is a bit slow, but then we are still intaking orders. We'll be closing orders by tomorrow evening.
Last minute business
We are waiting for them. Some people prefer to buy things late.
Buy pants, Thursday na ready corner. Saturday open your crowd go out Thursday open local foreign
Last year we had a lot of people coming here.
Last year
All of us here at JoyNews, we wish you a happy Valentine's Day ahead of that. But before I leave you, I'm leaving you with this interview that my colleague Jamapia had with the Ghana AIDS Commission, just highlighting the launch of a new condom strategy to curb HIV/AIDS.
I sit with the Director General of the Ghana AIDS Commission, Dr. Prosper Akammo. A year ago, he was appointed to this office to lead the country's charge against HIV and AIDS to get it closer to the 2030 global target of ending HIV and AIDS as a public health threat. In Ghana, available data shows that over 300,000 Ghanaians are living with HIV. And interestingly, the demographic survey shows that between 2018 and 2022, the use of condom, one of the most effective ways of preventing AIDS or HIV, had dropped. Dr. Akammo, welcome to JoyNews.
Thank you very much.
Tell us, when you took office, what were the numbers looking like in terms of HIV prevalence rate in Ghana?
Well, thank you very much for the opportunity. And when I took over the office of the Ghana AIDS Commission, as you rightly said, the task was to make sure that we got to the 2030 global targets of making AIDS not a public health threat. Specifically in Ghana, our figures were not that encouraging. Let me put in perspective that over the years we had made some progress in bringing down the figures substantially. But the typical Ghanaian syndrome, soon as you begin to make progress, you take your eye off the ball. And then we started having resurgence in new infections. And you know, the new infections build the base of the people living with HIV/AIDS. And as you rightly said, the statistics show that in Ghana here, we have over 334,744 people live with HIV/AIDS by our national estimates. That gives us a national prevalence of 1.49%. Yes, though we have come from a prevalence rate of 2.8% in 2010, but we should be bending the curve much more than that, especially if you look at the new infections rates. The new infection figures is about 15,290. And more worrisome with these new infections are the fact that if you take the age group 15 to 24 years old, they alone account for 30.1% of those new infections. That is not good enough, because these are people who are young, who are going to live long with the disease, who are going to have a lot of morbidity. They are the future workforce of the country, and if we don't take time and we don't bend down the curve and reduce infection rates in these people, we're going to have a future generation of people living with HIV, especially in the younger age. Further to statistics, we also realize that a lot of people are not on treatment. They are diagnosed but not on treatment. If you look at the global targets of reaching 95, 95, 95, that means that once we get to that level, we have reached a target where we can say the epidemic is under control. 95% means that 95% of people living with HIV in the country know their status. 95% of those people who know their status are on treatment. And the third 95% is that 95% of those who are on treatment have reached a virus level where you can detect it in their blood. That is very important.
But the concern also is there may be a lot more people living with the disease without knowing about it.
That is the problem, because if I come to the statistics with respect to that, you would see that the first 95, that is 95% of people who should know their status, we're only doing 68%. So even if you don't take the whole 100% and look at the 95, 68% to 95, about 27% are not in the know of what that's their status. If you take the second 95, that 95% of those who know their status should be on treatment. That one we are just doing 69%, when we should do 95%. However, those who are on treatment, we have reached 90% of those who are on treatment currently not having a virus detectable in their blood. So the most important thing is to get people tested. Once we get that baseline, we have to roll people onto a treatment. Once they get to treatment, we are very sure that they will get to a virus level that will not be detected in their blood. And at that point, if you get that, you can say that you are almost getting to epidemic control.
In terms of testing,
yes.
What is the problem there? Why are we recording such low numbers?
It's just because of the stigma that is associated with the disease. And you, as a journalist, you know that every disease of stigma in Ghana is highly avoided. And many people just fear to go and take an HIV test. But it is important to take an HIV test. First of all, if you know your status, you protect your status. And if you're positive, you roll on to treatment. And let me tell you that those who are on treatment are living their God-given years. As long as you are on treatment, unless anything untoward happens to you, not HIV, not AIDS that will kill you. Something else, you may die of something else. So it is important to get to know your status and be on treatment. And therefore, the next line of paradigm of thinking is to ramp up testing, especially making the self-testing available. You and I would know that if you have to go to a hospital setting or a medical setting to test, many people will not go. So we are now ramping up the self-testing mechanisms that you can come, register, take your self-test kit, go to your house, sit in the comfort of your room or your washroom, hide yourself, test, and these are things you can just roll in your mouth, test it, and know your status. You may grieve over your status for a while, but at a certain point you accept it and then you go for treatment.
Where
that is within the privacy of your own house. Yes.
Where are they supposed to get these?
You can take these self-tests from the antiretroviral treatment centers. You just go and they give them to you, and you don't have to take the test there for your status to be known.
Are they across the country?
They are all. We have over 780 of them across the country. In fact, we are even trying to vamp up more of those centers, making them closer to doorsteps, and even conveniently so, people can just go there and pick those.
Do you have these self-test kits available?
We have the self-test kits available. In fact, we within this Valentine period that's coming, it's one of our targets to ramp up the self-test kits, the self-testing. So from yesterday, I have distributed over 1,048 boxes. Each box contains about 50 test kits across the whole country to the technical support units of the Ghana AIDS Commission. And this will be deployed across the whole country for people to take up self-testing as part of the Valentine's Day celebration.
In December, on the floor of the House of Parliament,
yes,
the first Deputy Minority Whip, Habib Idrisu, made a statement. He was advocating that prospective employees be tested. It should be mandatory for them to get tested for HIV/AIDS before they are employed, and that will help improve the number of tests done so that people can know their statuses, because the problem is a lot of people do not know their statuses. What's your reaction to that?
Let me say that if you look the perspective from which he made the statement, he may have good intentions, but it may have been misconstrued across the public discussion. Let me say that the testing of HIV is governed by law within the Act 938, the Ghana AIDS Commission Act. You cannot force anybody to take a mandatory test of HIV test. It has to be a consensual agreement that the person has agreed to take the test. And the fact that the person has not taken the test cannot be the basis for which you deny him any employment. It's an act, it's in law. Maybe the intention from which the Ghana AIDS Commission saw the Honorable Minority Chief Whip trying to say is the fact that because of our low testing level, if we can find a mechanism across the country which may be acceptable for whereas increased testing, by increasing the testing, we can actually know the real prevalence, and we can actually bring people who are having a disease to treatment. That will curb the future spread of the disease. He may have been intending that way, but to mandatorily force somebody that you have to take the test to be able to get a job under the laws of Ghana is not appropriate. In fact, the Ghana AIDS Commission reached out to the Honorable Member to make him know that this is governed by law, and we can't just force people to do that. Get to know that just recently to the military recruitment, there was a false information in the public domain that 60% of those who had gone for the Ghana Armed Forces recruitment had HIV/AIDS. That was a false alarm. It's completely false and not true. The people who have gone for that recruitment training had also signed and agreed that they would take the test as part of the recruitment process before they were allowed to do the test. And that result of 60% is completely false. And you saw the military high command coming out to make a statement that this is not true. And it creates that more social stigma against the disease, which is not right in our culture.
I'm not too old, but when I was growing up in the late 90s and early 2000s, we saw on TV adverts telling people to protect themselves, abstain or use a condom. And that perhaps may have contributed to the low numbers we saw those years. But that's not the same now. You don't hear the adverts anymore on radio or see them on TV or even social media. What's accounting for that?
So you are absolutely right about that. Take 10, 15 years back. Almost on every media house, from print media to electronic media, you would see adverts of how to prevent yourself from getting HIV/AIDS and how to protect yourself. You had the ABC, abstinence, be faithful, use condom, take drugs, and then all those we used to advocate. But over a period, let's say 10, 15 years, all this died away. No, it's all because of the funding structure of the national response to HIV/AIDS. Much of our funding comes from external sources. And the programmatic outline is based on what the money is coming from. So from the onset, a lot of the money came for prevention because we didn't have the drugs to treat. So we just felt that if people prevented themselves from getting HIV/AIDS, then they would have a low prevalence of the disease. Fast forward along the line, we had very effective drugs. People could take the drugs and live longer. So a lot of the programmatic money went in about purchasing of drugs and other commodities that are related to medications. And therefore, that which was assigned to the prevention became smaller and smaller over the years. And that is how we got these messages slowly dying off the public discourse and making younger generation unable to know what was happening with respect to prevention. So that is the basis of it. So we now need to do a rethinking of the programming, because very soon we are going to go to the next cycle of funding, and we think that the prevention should take center stage. And even then, the previous funding for prevention was only for specific age, specific categories of people, people they call vulnerable and key populations. That is where the attention was on. But now, the general population is also vulnerable now. Take the general population, people who don't have much of the message are living very reckless lives, sorry to say that. I mean, there are a lot of people who they are serial monogamists. They take the girlfriend today, tomorrow they take another girlfriend, and that is a serial monogamy. That is also as vulnerable as any person who is like a gay or a lesbian or a sex worker or an AGYW, adolescent young girl who cannot bargain for safe sex, you understand, or an intravenous drug user. But the general population is also becoming vulnerable one way or the other because of lifestyle. It's not uncommon to hear people are doing sex parties and all those kind of things. These are vulnerable things that we need to do. And this information of prevention has to get to everybody, not a selected group of people. The general population has to be targeted for prevention. And
I'm thinking the issue even gets worse because the US in September last year also cut funding to AIDS-related programs. Did that affect Ghana?
Absolutely, because the US support for Ghana is, let me just specifically come to Ghana. The U.S. support for Ghana is specifically in certain areas. We have corporate agreement with Ghana Youth Commission that will look at the data collection and all those about the treatment, new infections, and all those. But more specifically, the U.S. interventions were in 3 of our regions: the half region, central, and western region. And the western of western and then a half central is not part of that. And their withdrawal affected interventions in these areas. And if you know the structure of the U.S. support, where they are operating, and by that directive, you can't have other institutions working there. They have just taken those 3 regions to give the support. So it actually created a little bit of instability in those 3 regions. And mind you, these are very critical regions in terms of the national prevalence. They are the regions where the extractive industry is very high. And if you see where the extractive industry is high, especially Galamsey and other structures, that is where migrant sex workers will go. That's where drug users will go. And these are the risk factors for all those infections. So that aspect of it actually interrupted our national response a little bit.
So these regions, mention them again: Western region,
Western North,
and
a half.
These 3 regions.
Yes.
These are the regions.
So they call them the PEPFAR regions.
Okay.
So PEPFAR is Presidential Emergency Plan for AIDS Relief. You understand? And it's instituted by the U.S. government. President George Bush instituted it, and then it has been support to areas, most countries across the world.
Are these regions the regions with the high prevalence rate?
For the highest prevalence rates is Bono.
Bono region.
Yes, that has 2.22%. The national prevalence is 1.49. Bono region has 2.2. They are the highest prevalence. But know that prevalence is the number of people who have the disease over the population. But in terms of absolute numbers, Greater Accra and Ashanti have the big numbers.
Right.
Yes, but because though the big numbers are in Greater Accra and Ashanti, the Greater Accra population makes it have a lower prevalence. But absolute numbers, they have huge numbers in the Greater Accra.
So the U.S. was helping Western North, and a half.
Yes.
After they cut funding, what happened? So now you don't have any support for these regions that they selected initially?
Fortunately, they had cut the support, but later on they gave an emergency period within which they can work. Now, going forward, we need to cover for interventions in those regions. And that's where the technical support in Ghana AIDS Commission will take over those activities there. But we need to get other civil society organizations that they worked with to be able to work there. In the meantime, there is a window of relief for the organization the U.S. government were supporting to keep the work going on there. Going forward, they are trying to sign a country-level agreement with Ghana for those interventions. The MOU has come out, but we are reshaping it to meet the national needs. Eventually, when we get those ones reshaped properly, then we can have an agreement for support in those areas as well. Know that the U.S. government is also the other donors to the national response, the Global Fund. The Global Fund is the institution that manages the global intervention for malaria, TB, and HIV. So they also receive funds and support country level. The U.S. government supports the Global Fund up to 40% to 45% of funding. And as they are withdrawing from that aspect too, the overall funding is also going to come down as well. Note that the U.S. government also supports the UN system and the WHO and other institutions like the UN AIDS. And as they are also withdrawing the funds, it also affects these organizations that are also supporting HIV responses in other countries in the global response. So their withdrawal is quite significant. And I think most countries, they've started having country-to-country agreement to see how they can support.
Would you then say that your operations were heavily dependent on the U.S., such that their withdrawal or their cutback has affected the Commission?
No, they were not completely heavily dependent. The systems they were supporting were linkage to treatment, keeping people on treatment, using community-based systems to link people to treatment. Sometimes people may not just have the desire to get up to go for treatment. You understand?
Even when they know that
when they know their status, yes. So they had built community systems to support all that. So there were community champions that were able to link people to treatment, keep them on treatment. Because sometimes when people take the medications, they start, when they get their sickness and they get into AIDS level, they start getting leaner, they go to hospital, they get the medication, they start getting well. They even look nicer and plumpier than even we those who may not have the disease. And then they think, oh, I'm fine, why should I take the medications again? And may not have the desire to go back to take their medications. They were linking up those ones, and especially other services of the treatment, stigma issues, building communities' resilience and strength to keep people on treatment. Know that the medications for treatment are supported by the Global Fund, which was still supporting Ghana, and with co-funding from the government of Ghana. So get to understand that the Global Fund will give us money, but Ghana will co-fund it, so that we buy the medications for the patients to use. So that support was also going on. Remember.
So the medication is free.
Remember, yes.
Right.
That when the US withdrew the funding, the President of the Republic called emergency meeting to reflect. When we went, we had to give him the exact nature of the withdrawal. And he had ordered the finance minister to make sure that all funding gaps were covered by that. So through the National Health Insurance, and the uncapping of national health insurance, a lot of money was released to cover for the activities of the withdrawal. And that was why we didn't have so much instability within the period of the withdrawal. Yes.
The medication is free?
Medication is absolutely free.
Absolutely free?
Absolutely free.
And people can get access to the medication in all facilities?
In all facilities. So we have over, as I said, 748 antiretroviral treatment centers. There are other specialized centers so that you can also go to. There are private and other centers you can go. But wherever you go, it's always free. Yes.
So currently, in terms of funding, you would say that overall you are getting your funds from the Global Fund and the government of Ghana.
Yes.
Or there are other donors.
There are other donors. UNAIDS, United Nations AIDS Foundation, and then as I said, the U.S. government were also through USAID. But two other cooperative agreements, they are also having country level agreement. However, let me put in perspective that all the foreign donors, over the period, we've realized that there has been gradual decline. And we have been looking at the fact that one day there will be donor fatigue, and we must prepare ourselves to take over our national response. So the government of the day, John Mahama, has tasked us to look at sustainability mechanisms. In fact, that was enhanced by the African Sovereignty Conference that he had in Accra here. Talked about taking sovereignty of our own needs, including health. But health sovereignty was actually one of the main things that he spoke about. So we've developed a roadmap of national sustainability, what we should do in case all this funding comes to a sudden halt. So we finished the first part A of it, the route, how to integrate our services into our already existing health structure. And we've had discussions in that part of the roadmap. In fact, we've actually launched it. And we've had the discussions with the National Health Insurance Scheme, because we can actually integrate all these services into the National Health Insurance Scheme. You know, so that all the drugs and everything are purchased for that. We've also realized that much of our counterpart funding and much of the money that the Global Fund is giving for treatment, about 68 to 70% of the money goes to buying medications. So we have also undertaken a study to look at the feasibility of local industries, local pharmaceutical industries, producing the medications in the country here. We finished that feasibility studies, and right now we have two companies that, if they are given the opportunity and the necessary arrangements, should be able to produce those medications for us. Why would Ghana government put a counterpart funding of, let's say, almost $40-something million, or $50 or $60 million, $80 million to purchase medication outside, when we can support the local industry as part of that? And the president's manifesto, the NDC's manifesto, to look at the fact that building of local pharmaceutical industries is a hope for us to gain that sovereignty in our health sector. If we dovetail our sustainability mechanism into that, it would support the national effort in building resilience and sustainability. So we have done that with the National Health Insurance Scheme.
From the time you took office till now, have you done any studies to look at the prevalence rate? Because we know that somewhere in 2024, that's when we recorded over 300,000 people with the people living with HIV? Have you done any study like that?
The studies to get a new, it's a continuous study.
Okay.
It's not a one-time. So we have the mechanisms across the whole country collecting data for new infections.
Okay.
So on a dashboard, in fact, we have what they call an e-track. On a dashboard, you can see what are the new infections that are coming. Currently, as we speak, the National Estimates team is at the Cathedral and they're taking a conference. They are looking at how we can now aggregate all that data into bringing out the new estimates for 2025. So, of all the processes of collecting the data, from sentinel surveys, from pregnant women, from testing kids who are newly born, from self-testing, from all the aggregated data, we will look at the new infection. We also look at those who are on treatment. We also look at those whom we'll be able to prevent from mother-to-child transmissions. And we also look at other aspects of the national statistics as well. So within, let's say, by April, we should get the estimates that we'll be able to do for 2025 to reflect the work that has been done since a year ago.
JoyNews did a vox pop of Ghanaians, whether they use condoms. And what we heard predominantly was that people are not using condoms. 13th February is slated as the International Condoms Day. And this is the first time Ghana is commemorating that day. And the 14th of February as well, Valentine's Day. Why do you think people are not so much interested in using condoms, and what would you say to them?
If you follow the Ghana Demographic Health Survey, and the estimation of the use of condoms is very low, very abysmal, and that is not good enough for a country. There are various reasons why many people don't use condoms, you know. And first of all, the fact that people say they want intimacy, direct contact. And people have also said that our condom, in fact, we have taken a survey of people's perceptions of the free condoms that we distribute. Ghanaians say they are too thick, they don't give you sensitivity, so we are putting all that together. And very soon we'll come out with a national condom strategy, national condom and lubricant strategy, which will now look at all the information we've gathered across the country about people's perception about the use of condom, so that we can refashion the kind of condoms we're doing to meet people's need. Maybe what we are providing is not what they want. We are also doing that study alongside the use of other condoms that are not under our program. People would go to pharmacy and buy the type of condom. We're taking all the statistics together to see whether there's a preferential direction where we should go, and the reason for that preferential direction, so that we can prepare our national condom strategy properly. Yes, but some of the reasons people will not use is the fact that they want direct intimacy. And of course, if you look at the use of condom, if people have intimate relationship for, let's say, about a week, they may use a condom for a week, and by the third week, they've stopped using condoms. They get used to each other, and that is how it goes with Ghana. And the other thing is that the female condom, we had a little bit of problem with the female condom. It ran out of the system. In fact, one of the biggest requests we get is the female condom. First of all, the first one was inappropriate for our Ghanaian environment. The second one, the second set, after taking the national information about how to manage the female condom, we got a newer set which was more acceptable now. But of course, there had been issues of items that are locked up in the pot that we've not been able to clear. We're trying to get those ones sorted out. But it is, if we need to vamp up our condom use, the next condom strategy will look at the reasons why we are not men are not using condom that well and properly, so that we can also develop and get condoms that are more friendly to the Ghanaian use. You get to know that there were some times that there were condoms in the system. They said they were smaller for Ghanaian men, and that they were bursting because I know Ghanaian men are quite in doubt in one way or the other. So we leave it like that.
So you'll be sharing condoms on the 13th of February.
Yes.
Yes. And tell us about this free condom. Does it meet the needs of Ghanaians? 13th
of February has always been World Condom Day. And in fact, for the first time, Ghana will be observing it. Ghana AIDS Commission is leading this together with the AIDS Health Foundation, who are now entering Ghana for the first time. So we'll launch it on the 13th of February. And this is where we bring the awareness to the use of condoms. It's part of the strategy to make sure people get to know that, look, there's International Condoms Day, and let's use condoms, and we can get the public awareness about condoms. Secondly, we'll be doing condom distribution of all types of condoms, and people can have access to the condoms on the distribution day. But more importantly, it dovetails to the Valentine's Day.
How many condoms will you be distributing?
There will be various types that will be there, flavored, non-flavored, and all those kind of condoms.
Okay.
So we target to distribute
across the country.
Across the country. And as I said, in sending the HIV self-test to the regions, I also send some condoms to each of them. Yes. Right. So it is to prelude the Valentine's Day. Because
please turn to my camera and then speak to Ghanaians about the Valentine's Day and how they need to protect themselves.
Valentine's Day, a wonderful day of the year for us to share love, affection, and be with our loved ones. It's a day of love, sharing chocolates, love messages, gifts, flowers, teddy bears, whatever, even giving our hearts out. But it also leads to intimacy. And in our excitement about sharing in our love, we need to be careful about how much intimate we get to ourselves. We need to take responsible decisions about our intimacy and protect our lives. Wear a condom. If you are stay faithful to your partner, or if you are not faithful, please wear a condom to protect your partner. Let's enjoy this beautiful day, this fantastic day of the year, sharing our chocolates, our heart-giving affections, our minds, our souls, our energies, but let us use condom. Yes.
Thank you so much. Dr. Prosper Akamor is the Director General of the Ghana AIDS Commission. Thank you for watching. My name is Gemma Appiah.